Welcome to The Bridge, Your Health, Your Voice, the official podcast to the University of Maryland, Baltimore School of Pharmacy Patients Program. The Patients Program is the bridge between the community and researchers. This partnership is created to help researchers listen to the community's voice in order to build a bridge to an effective learning healthcare community.
All right. Hi, and welcome to The Bridge. I'm Paris, and I'm going to be your host today. And we have a special guest, Dr. Claudia Baquet. So we're going to have you introduce yourself, and then we'll kind of just let the questions flow and see where we go, okay?
Thank you very much, Paris. Really appreciate being here. Again, I'm Claudia Baquet. I'm a physician scientist. I am a member of the Patients Program, and I am affiliate professor in the School of Pharmacy, and have a long history of conducting health equity and health disparities research, starting with cancer research, bioethics research, and regulatory science. Thank you very much for having me.
Thank you for being here. That is a long list of things to do, okay? All right, so we just have a few questions for you, and we're looking forward to just kind of chatting about some things. So if you would like, can you explain to us what is informed consent?
Okay. Informed consent is the process that researchers have to adhere to assure that people they want to volunteer to participate in health or medical research studies, including clinical trials, truly understand what the study's about and can give their consent because they do understand what the study is about. And informed consent and its history has a long history influenced by some of the research transgressions of the past or unethical research of the past, but it is one of the hallmarks of assuring that people who volunteer for research, health research in particular, clinical trials, for example, truly understand and can therefore give their consent to volunteer to participate in research.
Okay. So you talked a little bit about the historical context of informed consent. Could you give us some examples of, times where maybe informed consent wasn't used to the best of their ability, or some historical context behind it, just so our listeners kind of have an idea of why this came about?
The hallmark example is the Public Health Service, or PHS, untreated syphilis study that took place in Tuskegee, Alabama, Macon County, Alabama. And that was a study from 1932 to 72. It was only supposed to be 6 months, but it recruited Black men in rural Macon County to participate in the study, about 600 men, about 400 with syphilis and about 200 as controls or comparisons. The men were recruited saying that they were going to be recruited for a study on health and that they would be provided certain things if they agreed to participate. And the certain things included food, health care, and burial insurance. They were not told that the study was a study of the natural history of the disease called syphilis, where even if treatment was available, they would not be receiving treatment. And it turns out during that time period that penicillin was discovered and eventually used broadly by the 50s as the cure for syphilis. However, that was not offered to the men in this study. As a result, this is a violation of informed consent. It didn't have the regulatory, what I would say, clout that it does today. It turns out that a reporter repeatedly exposed the unethical nature of this study. And finally, in 1972, when it appeared in a newspaper article, the public was horrified, Congress was horrified, the study was finally shut down. As a result, later on, uh, the federal government was directed to come up with a framework for what we call ethical research practices, informed consent being part of the ethical research practices, so that this transgression, this unethical research would not happen in the future, and that researchers are obligated to adhere to the ethical principles that are part of this framework that were laid out in something called the Belmont Report. And the three principles are respect for persons, justice, and beneficence. Informed consent is the practical application of respect for persons.
Wow. So just even hearing that, I remember being a child and my family kind of telling me this story. And to think of it, I'm 35. So to think something like this happened where the report was published in 1972, here I am in 2025. And I think that that level of trust is still something that public health lacks because we still remember. So it really is interesting to hear the historical background behind it, but it also kind of hits home for me because I get to understand a little bit more context to why culturally we have serious trust issues with the healthcare system in general. And I wasn't even a part of that time era, but I'm still feeling the effects of the things that happened then.
Yes. Now, the Belmont Report came out in 1979. And prior to that, right after the public health study of untreated syphilis in Tuskegee was terminated, a commission was convened to lay out the ethical principles. You know, the ironic thing, I always call it the Public Health Service study of untreated syphilis in Tuskegee, because as a medical student, when I was at Meharry Medical College, I had the privilege of spending 6 months in Tuskegee for 2 rotations. One was OBGYN and the other was internal medicine. And the internal medicine rotation, I got to go to the locked psychiatric wards where some of the remaining patients from that study who had tertiary syphilis because they weren't treated were in those wards, and they were some of our patients as medical students with the residents. So the community told me it's not the Tuskegee study. Please don't say that. Say it's the public health study. It's the government study. And so, as a measure of appreciation for how wonderful the community was to us as medical students and their request, that's why I refer to it as the PHS, or Public Health Service study of untreated syphilis. And that, as you say, that remains in people's minds. Even when you have more contemporary concerns about ethics on the part of the community, such as some of the uh, things that occurred during the COVID-19 public health emergency, people still mention in some of our studies when we ask, what are your barriers? What stops you from participating? And they'll say, we're concerned that another Tuskegee or another untreated syphilis study may occur. So, yes, although that's been a while in time since it ended, that's still fresh on people's minds. And there are other examples. In 1946 to 48, the Public Health Service had an STD, or sexually transmitted diseases, study in Guatemala, where they intentionally infected a host of different types of individuals with sexually transmitted diseases and withheld treatment and to observe uh, these diseases. So, we have the Guatemala study that the U.S. government apologized in 2010. We have, for indigenous populations, the Havasupai tribe in 1990 was asked by Arizona State University to donate blood. They did 200 blood samples, and we're told it was a study on diabetes, but it turns out they used the blood for purposes other than were divulged.
Wow.
to the tribe. And so that led to a lot of reframing what's ethical when it turns out that you donate your tissue or blood samples. What can investigators do and not do with those samples? So there are other examples, and of course for Maryland and Baltimore, Mrs. Henrietta Lacks, and reproduction of her HeLa cells, distribution of them to many investigators without her consent. After she died shortly after she was diagnosed with invasive cervical cancer, but even the family members not knowing for years that her tissue was being used and distributed, not just in the U.S., but globally.
Wow. I just actually learned not too long ago that they used her cells to help develop the COVID-19 vaccine. And I thought that was particularly interesting considering y'all took them without consent anyway, but here we are still benefiting from her cells today in 2025. So I'm eternally grateful for her cells, but also there's a part of me that is like, we could have just done the right thing. We could have just done the right thing. It's a possibility she just might have been okay with it, but we just took her autonomy away from her. So that kind of goes into my next question. Like, what does autonomy mean when we're talking about informed consent?
Yes, well, autonomy means that the individual has the right to make an informed decision about whether or not they will or will not participate in research. They have the autonomy, the power to make that decision. But in order to make that decision, to really truly have informed consent, to truly implement that principle of respect for persons, there has to be the correct information. What is the study about that you're asking me to participate in? What are the potential benefits and risks? How long is it? Is it inpatient? Is it outpatient? How can this be assured that this is voluntary? Voluntary meaning that you're not coerced either by a threat or withdrawing some benefit to which you are already naturally entitled to, that your autonomy is being taken away because you are being forced or coerced into participating in a study to give consent. So voluntariness, information, and comprehension. Comprehension is really critical. You can provide all the information on the study, but if the potential participant doesn't understand it, if it's not at a reading level or literacy appropriate level or even cultural relevance, then you're not going to truly achieve informed consent. And so it's the responsibility of the investigator, the researcher, to assure that these things are met during the informed consent process. And I mentioned earlier that informed consent is how you operationalize the respect for person principle.
Wow.
We hear a lot, and we've been so fortunate to be able to do many studies and projects on this topic from the community's lens, to ask the communities, what do you think about informed consent? How can we make it more community-centric and patient-centric, which is the focus of a project that we've been working on, supported by the Food and Drug Administration. And in these qualitative research settings, town hall meetings, focus groups, interviews, we've had such rich suggestions from the community on how to improve informed consent. Decades ago, people said, well, for example, people of color, Blacks or African Americans were not interested in research. This is absolutely false. There's tremendous interest in research participation and understanding its value to improving health and the health of the public if certain criteria are met. And that includes the literacy, that includes the respect, that includes recommendation from, I'd say, probably 90% of the most recent research studies we've done. 90% of the participants state that return of research findings at the end of the project is imperative, as well as providing some type of post-study access, whether that's access to care or access to the agent that was studied, if a person's eligible. And interestingly enough, at least 90% of individuals state that they believe during the informed consent process that this should be discussed so that people can truly make a decision. We've heard so many times that people have told me, I participated in a clinical trial about 6 years ago, and I still don't know the results. The trial's over. I haven't heard from anybody. I would like to know what happened, if there's anything that's of potential benefit to me, my community, or my family. And so the participants that say you need to tell us in the consent process, when you're discussing that form, when you're discussing the study, when you're providing the information to help us comprehend, to make a decision, you need to tell us that you're going to return the research findings at the end of this, and that post-study access will also be provided if that is appropriate. Those are very, very important and powerful recommendations from members of the community that we're in the process of kind of disseminating that information through publications, through give back sessions, through scientific publications, so that other people understand the importance of this. You would think logically, if you do a study, that you're going to return the results. But people tell us they haven't heard anything from investigators after they consented. So this is a very important finding, we feel, from the research and the projects that we're doing.
Yeah, I have to say, I agree with the 90%. If I'm taking my time to do a study and you're learning from me, then why am I not learning from you in return? And, if I did the study, it's because I obviously believe in what the cause is, or I believe that it's something that will deeply benefit my community. But then you take the research and then I never hear anything about it again. Or if you do hear something about it again, it's written in a publication that is not necessarily health literate to the average reader. So then they really don't know the results. So I agree with the 90%, honestly, because it just doesn't seem ethical. And I come from like a marketing background. So when we are testing a product or something like that, you get samples, you get feedback, but you know the results of what happened to the product. You might get samples of the product well after it hit the market, or they may continue to send you, goodies after you finish the study. So it's very interesting to me that oftentimes in health research, they don't kind of take the same standpoint as product research, I guess. So that's very interesting that people are saying they want the results back, but I would assume that would be something that is automatically given.
So we've been, for the last several years, conducting research to emphasize the community's concerns about the ethics of the research. So in addition to concerns about whether this is informed consent, am I going to get my results back at the end, or the whole study's results at the end, people also are very interested in making sure that the researchers have appropriate training in how to assure that the community's concerns about informed consent or ethics in research are met. As a researcher, we have requirements for ethical protection training online, but the community says to us, we need to go further than that. You need to understand that the ethics that the community is talking about is not just simply the regulatory requirement that a researcher has to meet to do a study. It's a requirement to meet what the community feels the researcher should do.
Right.
And I mean, as you well know, that focusing on community engagement, community ownership, and participation as part of the research team is the hallmark of the patient's programs, both vision and mission. And so, we're still in the process of finishing up our projects. There's an intense dissemination plan in the works. The community is part of that. In fact, the community says maybe you should get the researchers and the community in a room so that the researcher is talking about the study they want to recruit for, but the community says, that's not what we heard you say. What we heard you say was something totally different. So you really need to break it down to us, or we're not going to be able to consent to participate in your project. So
I love that. So that really segues into my last question that I have for you. How do communities do this? Are there resources for communities to be able to learn how to better advocate for themselves for this?
with the studies that we've recently conducted, I'd say recent meaning like in the last 5 years, on this topic of community ethical concerns about research and research participation, including consent, we have done a number of things. We've provided at the end of the sessions copies of the Belmont report. People have asked us for it.
Yeah.
They've asked us for summaries of the PHS untreated syphilis study in Tuskegee. We've provided that. We've provided that to participants, but we've also at community events for people that are interested, provide those materials. What we're going to be producing with the completion of our studies are other materials and other opportunities for individuals to learn about what are the existing ethical protections and how to make informed consent, for example, more community and patient-centric instead of just researcher-focused.
Thank you so much, Dr. Baquet, for being here. This discussion has been robust. We really appreciate all the work that you have done and all the work that you're going to continue to do.
Well, thank you again. I really appreciate this opportunity to talk about what we're doing. And I'd like to acknowledge some individuals. Of course, Dr. Mullins, the founder of the Patients Program, Nurse Barbara Jean Shainman, who is our senior recruiter for a number of these studies, Dr. Jasmine Cooper, our director of qualitative research, the Dean of Health Professions, Dr. Joan Tillman at Coppin State, who's also a partner in our studies, Dean Kathleen Kennedy from Xavier University College of Pharmacy, and all the wonderful participants who have taken so much time to educate us and to make recommendations on how to make informed consent a better process for the community, as well as to assure issues related to community ethical concerns are addressed. Thank you.
Thank you so much for being here again. And thank you to all those people she listed at the end. We appreciate everything you're doing for us, our community, and furthering research.
Thank you for listening to the Bridge Podcast. To learn more about the Patients Program, visit our website at www.patients.umaryland.edu.